Whether you realize it or not, 3D printing in medicine is impacting patients' lives today. Here at the Children's Hospital, we've been printing hearts. In the field of congenital cardiology, patients born with varying types of congenital anatomy result in very difficult 3D structures where baffles have to be created through these complex structures. And in the world of medicine, we've graduated up from chest x-ray to CT, MRI, and even 3D hearts moving in front of us on a 2D screen. But there's still that missing element of really interacting with and understanding these hearts in this new dimension. And what we've discovered is when we print a complex heart, when you hold it in your hand, your level of understanding increases exponentially from existing technologies, especially in these complex cases.
Instead of looking at a series of two-dimensional images in any angulation, the 3D display really adds value because you can all of a sudden see all the relationships of the structures to each other. It was unbelievable how much extra information that captured in terms of separating these blood vessels that were coming off the aorta and the orientation, the distance apart that they were, the size, the relative sizes. It was all extremely easy to kind of understand that from one look at a 3D model versus spending 10 or 15 minutes with a 3D data set.
One thing I've struggled with is really conveying the benefit of 3D printing in congenital heart disease. And one day I was watching my son play with a toy. He's got this little 3D puzzle ball. And what we did is we brought it into the hospital and we scanned it through the CT scanner. As you look through it on a 2D screen, and you can see every intricate nook and cranny within this puzzle, it's hard to really make sense of what it is and what its purpose is. Yet, when I hand it to my 5-year-old son and ask him, where does this puzzle start? He can flip through that thing and find the starting point in that complex puzzle very easily. But if I were to ask a seasoned radiologist to scan through these X-ray images to find the starting point, it's going to take him a little while. I am confident he'll get there, but it's going to take a while. And it's just that incredible dichotomy between our understanding when we're designed to learn in 3D and we can see it and interact with it in 3D. That is the benefit of 3D printing in congenital heart disease. Congenital heart disease is a complex 3D structure and is the perfect substrate for understanding the benefit from going from 2D to 3-dimensional imaging.
Doing 3-dimensional imaging and then creating a digital or printed copy of a model of that patient's heart can help cardiologists decide what procedure to send their patient for. It can help surgeons decide on a strategy for cardiopulmonary bypass. And then most importantly, it can help the operator understand the position of all the components of the heart as they approach things like closing defects or holes between two chambers of the heart. Having a 3D printed model to look at has the potential to really assist with planning these complex procedures.
The purpose of the National Institute of Health's 3D Print Exchange and Heart Library collection is to be a high-value, high-quality repository of 3D hearts. The educational value of a library of congenital hearts is vast. Not only do you have the direct patient impact on complex cases and with the treating team, the cardiologist and the surgeon, but the educational value for parents. The potential for expanding the understanding of these complex anatomic variants to everyone is tremendous.
Imaging really guides therapy, and imaging also provides a basis for educating the next generation of physicians. So this 3D library that is being formed is really important, not just to the patients who are benefiting from the 3D models of their own anatomy, but really it's benefiting hopefully generations of physicians and healthcare professionals.
Not only are we creating a library of hearts, but we're creating a community of experts, which will be an incredible resource for families, residents, med students, physicians, but most importantly, for those few children where this will make an incredible impact. And I can't think of anything else that would bring a smile to my heart than helping these kids like that.